Good afternoon. My name is Joanne, and this is my reflection video for phase one of D156, business case analysis for healthcare improvement, or the HIP. So, as I begin to develop my healthcare improvement project, I consulted with my SME regarding the potential stakeholders that I should include in this project. And prior to deciding which improvement project I should work on, I actually had three different areas that I wanted to focus on. I had discussed this with my clinical instructor, and she gave me feedback about what she thought and the pros and cons about these areas. So I had to conduct some researches about the different healthcare problems, or the three different healthcare problems that I chose to work on, to ensure that I have enough data, or yes, research work that I can use later on, like peer-reviewed articles or researches or EBPs or benchmarks. And so fortunately, almost all of the improvement projects that I planned to delve in have enough studies conducted, but most of them were unfortunately more than 5 years. So that made me narrow it down to two problems. And then what made me decide to choose this particular health improvement project that I'm going to work on right now is the many articles or studies, researches conducted about this issue. And so I am even more fortunate that I have the support of the stakeholders that I chose, who are more than willing to volunteer information regarding the said project. And I chose the case coordinator, the follow-up program coordinator, and the prospective payment system coordinator. My project is all about reduction of preventable hospital readmission. And so the case coordinator, her role is to identify identification and placement of patients post hospital situation, or hospital home is, or I'm sorry, post discharge, or going home, or what's that again? I'm sorry. Home or nursing home. And then the determination of the barriers towards successful transitioning post-discharge is also the role of the case coordinator. And she is also responsible for the logistical coordination of care or resources geared towards self-management. And she is one of the persons who ensure that a follow-up with the PCP or outpatient clinics is done prior to discharge. So when I spoke with the second stakeholder, the follow-up program coordinator, she mentioned that part of her role is to provide patient support post-discharge through phone calls or visits, either via virtual visits or in-person visits. This helps her identify discrepancies of care plans that were put in place prior to discharge, clarification of misunderstandings, and answering patients' questions. And also, she is responsible for the follow-up, or to ensure that engagement with the PCP by the patient or with the patient. That way, follow-up with their doctor regarding medications and new or continuity of care is ensured. And then the third stakeholder is the PPS, or the Prospective Payment System Coordinator. He is the one responsible in assisting in ongoing monitoring of identified benchmarks for the target population. He also he's responsible in provision of coordination and accurate completion of the care tool for each patient to be submitted for UDS. And then he also supervises the admission screening to ensure appropriately qualified patients are admitted in our facility, and also provides ongoing education and in-services to all clinical staff on the quality improvement monitoring, updates team of QI scoring trends and changes. So overall, so far, it's been a good start. So hopefully it's not going to be as hard as I complete this project. And thank you for watching.